So we have a three-part lecture on the life courses and influences on it, which brings us a number of factors: environmental, social, biological. Moving on. Yeah, so that's what we'll look at. We'll look at a useful resource for you, talk a little bit about the current situation. Mention life course approach and mention Marmot, which we will come back to later in the module. So the life course. Here's a useful resource, Sage Research Methods. It's a pretty good online resource for finding a range of public health information and models. Also some good referenceable definitions. You'll need to go in via the library databases page. If you just try to Google for it, you won't be able to log in probably. So go into the library and search in the databases. So here's a short exercise. Open Sage and search for the term life course. This is 2 words note. Searching for this as a single word will not bring the desired results. Locate and watch this video over here. Take a note of the speaker's comments on the development of children. You may also want to look at the range of other resources the search locates. And here's an exercise for you to do before the tutorial. Have a think about possible major events during your life course. Pause the video presentation, complete this exercise before going any further. We will discuss this in general terms in the tutorial, but you will not need to share any information you don't wish to. I might set up a form to collect information anonymously, but I'm not sure I'm going to have time to do that. May do it later on. Everyone is different, and many factors are influential during the life course. There may be some unfamiliar terms here. For example, dyad. You may be able to guess what this means. It's a term from sociology, meaning a group of 2 people, the smallest possible social group, hence its association with the diagram with families and other social groupings. If you want to know more about this, this book, Source Book of Family Theory and Research, can be found in Sage. Mentioned a couple of pages back. Time is important, of course, so we might as well explain these terms as part of the general background. Linear time is a concept that time is seen as a sequence from the past to the future, which sounds reasonable. Physicists might beg to differ. However, in terms of the way we live our lives, the idea of clock time, where individuals let an external clock dictate when tasks begin and end, and event time, where tasks are planned relative to other tasks, may be more important in understanding issues such as how people organise their lives, or where stress arises from or can be alleviated. So here's another short exercise about the life course. What do you think are the most important stresses that may happen to a person during their life? As usual, pause the video presentation and think about this before moving on. No peeking, but this material is from Hutchinson, which is included in the notes. As you might expect, the death of a spouse and divorce are seen as the most important potential stresses. Lots of other issues, and this is obviously not a complete list, and was written before COVID, of course. So speaking of COVID, especially given recent events, the paper linked here reviews emerging knowledge about the impact of the crisis on loneliness in the UK. There are also issues such as change working patterns, including one job that I can think of has pretty much come down to working at a computer all day long. Sigh. But have a look at the PLOS paper if you're interested. Moving on. So, some concepts and definitions before we go any further. As I mentioned, when you use a phrase for the first time in a report or something like this, you should always define it and reference it. So here's a definition of the life course. We've gone back to Sage, the Encyclopedia of Epidemiology, which is a good source again in there, describing what the life course approach is. A number of similar definitions you'll find in the literature. Some key concepts you may also meet when reading in this area. I'm not going to read them. Suffice to say them, you can find them in Sage, again in the Encyclopedia of Epidemiology. Morbidity is a condition of suffering from a disease or medical condition. A related term is comorbidity. That is when someone has one illness or condition, morbidity, at the same time. It is important to note that people who live with a range of comorbidities may well die of something else, such as severe COVID-19 symptoms, for example. Mortality is the death rate in the population. This may be an overall rate or the rate due to a particular condition in a particular group. And there's a link there to Healthline, which has some good discussion of what the difference is between these. This is a concept that's come up quite a lot in the news recently. Here's an example calculation. You might want to run through the numbers yourself. It's pretty straightforward in principle. We start looking at the detail of death rates in particular groups from particular conditions. It can get quite a little bit more complicated. Excess deaths, again, a concept that has become important, as quoted from the British Heart Foundation, not Hearth Foundation, it says in the notes. Defining the term has much been in the news recently. Excess deaths. For example, if 200 deaths were expected in a given week and 300 were recorded for that week, there would have been 100 excess deaths. Excess deaths are a good model to determine the impact of things like the coronavirus, and probably one of the best ways of looking at this. It's particularly useful because the causes of death during the pandemic may not have always been accurately recorded and reported. Doctors are still learning about the virus and may misdiagnose some illnesses, COVID-19, or miss some cases entirely. But the total number of deaths is not affected by this. Looking a bit wider, it's a few years old, but it shows our understanding of these issues can illuminate our understanding of things like inequalities around the world. It's quite stark, the data here. And again, if you click on this, it'll bring you up to more information. Okay, so the life course. 3 videos for you to watch before the tutorial. Clockwise from the top, the first one reviews the life course concept. The second one is Sir Michael Marmot on the social determinants of health. And finally, another view on the same topic from the always excellent Armando Hasdungan. Think about the impacts the coronavirus crisis has had on the issues discussed by Marmot and Armando. So stop the video and have a look at these other videos yourself. You will look at Fair Society Healthy Lives, normally known as the Marmot Review, again later in the module, but it's such an important report, it's worth mentioning here. It is now 11 years since the original Marmot report, and the conclusions of the 10-year updates, some of which are summarised here, remain depressingly familiar. In England, people living in the poorest neighbourhoods will on average die 7 times earlier than people living in the richest neighbourhoods. Also, the average difference in disability-free life expectancy is 17 years. The authors also say we can draw similar graphs to figure 1, which is the one above, classifying individuals not by where they live but by their level of education, occupation and housing conditions, and see similar gradients. Put simply, the higher one's social position, the better one's health is likely to be, and the converse is obviously true. And there's just it marked down in terms of life expectancy and disability-free life expectancy, which is obviously a key component, and a 7 and 17-year difference is stark. This was another graph which was seen quite widely when the first Marmot report was produced. It's a little bit complicated, but what it's saying basically is that children who have low cognitive scores at 22 months of age, but who grew up in families of high socioeconomic position, improve their relative scores as they approach the age of 10. However, the relative position of children with high scores at 22 months, but who grew up in families of low socioeconomic position, worsen as they approach the age 10. Which again is some pretty stark data. Here's another impact of socioeconomic status on child deaths on the road, and a question for you to have a think about. Why the difference between socioeconomic groups? Okay, the life course. I'll move on and we'll talk a little bit about this. This is taken from the Marmot Review. The diagram identifies key life stages and makes the point that both negative and positive influences start early in life, and in some cases even before conception in the health of parents, what are called epigenetic factors. From this early start, such factors accumulate through life. They cast a long shadow, and we'll look at this in more detail in the next part of the lecture. These effects are strongly related to issues such as education, employment and income. Again, more later in the module. That's all I want to say about this part. I'll be back shortly.